This conference will now be recorded.
Okay. And I wanted to do that just because we do have some people who might not be able to join us today that are interested in what we have to talk about. So last year I was unable to be physically present for the annual meeting as I was inducted to the office of the chair of the nursing section. With that hurdle and with COVID, our full executive committee has not met in person throughout this entire term. And actually, I haven't met a lot of my executive committee face to face ever. So that was a really interesting hurdle, but throughout the year, we've gotten really close and we've gotten a lot of work done for this fall educational conference that's starting this morning, as well as other things that we've worked together on. I'm really thankful for their combined leadership and dedication to the NCPHA nursing section in the 2019-2020 term. This team has put together an incredible amount of hours in service to the nursing section of the North Carolina Public Health Association, and I'd like to recognize them now. So this is your 2019-2020 PHN NCPHA Nursing Section Executive Committee. We have Carolyn Hemrick, the treasurer from the North Carolina Department of Health and Human Services. Joy Smith is the secretary from Gaston County Public Health. Dr. Marianne Cockcroft, vice chair of education from UNC Chapel Hill. Felicia Reed, vice chair of communication, Guilford County Public Health. Dr. Susan Little, immediate past chair, North Carolina Department of Health and Human Services. And myself as the chair. I work for Forsyth County Department of Public Health. So please join me in giving a round of applause to the other section leadership for this year. Thank you, Executive Committee, for all you've done for nurses all across North Carolina this past year. All right, now we will move on to the treasurer's report. And Carolyn Hemrick, our treasurer, will be discussing that. Whenever you're ready, Carolyn.
Well, thank you. Good morning, everyone. For our treasurer's report, we have two items in our treasury. One is the Joy F. Reed Scholarship Fund, which has $2,557.74. That is present, but before anything was removed for this year's scholarships. And then our primary fund, which is made up from dues and donations, we have a total of $7,450.47. So a combined total prior to the scholarships being removed, $10,008.21. So thank you all for joining in your dues, and that's the treasurer's report. Any questions? We placed them in the chat box, correct, Lindsay, if there was any, correct?
Yeah, and I don't see any. So.
Great. Thank you so much.
Thank you, Carolyn. All right, so next we'll move to our year in review. We've had a very busy year as public health nurses, and specifically in the public health, the NCPHA nursing section, we've had a very busy year. In November, we were able to update the nursing section bylaws and manual of procedures to reflect our current group and financial involvement. We also included descriptions of several of the scholarships and awards we offer, which had not before been included. You can find the bylaw and the manual of procedures on the NCPHA nursing section webpage, which I will drop in the chat box at the end of this. We also hosted 4 GSK vaccine preventable disease webinars, as well as 2 from Sanofi. In April, many of you wrote letters to the North Carolina Medical Board, NC Board of Nursing, and the Rules Coordinator in opposition to the proposed language change to 21 NCAC 32M.0104, addressing physician supervisors for nurse practitioners. The proposed changes, if they were adopted, would have had serious negative impacts for local health departments. With support and messaging from the NCPHA nursing section, along with many others, the chief public health nurse was able to attend and speak at a public hearing on this matter in May. The North Carolina Board of Nursing has officially pulled the proposed language and decided to go no further in rulemaking at this time. They also shared that if they initiate further discussion related to this topic, the Board of Nursing will reach out to the Chief Public Health Nurse for input, who will in turn reach out to public health nurse leadership, i.e. this nursing section, as well as many of you, for input. Truly an example of nothing about us without us. We've also had continued participation in our Facebook North Carolina Public Health Nursing Community page and Twitter page, including a campaign in May that spotlighted and celebrated public health nursing as part of the larger NCPHA social media campaign. In July, in partnership with the Chief Public Health Nurse, we offered a 1-hour mid-year call for all North Carolina public health nurses, not just those involved in the nursing section, focusing on stress and coping in the time of COVID and hot topics in NC public health nursing, including resources for sheltering. And of course, we would be remiss if we didn't mention COVID. This has been a particularly stressful year for public health nurses. So I wanted to take a minute to recognize just some, by no means all, just a handful of nurses that have shown truly exemplary dedication to public health nursing and to the North Carolina health and well-being of our residents. First, we have communicable disease nurse Lisa Daniels. She's honored as Spring Arbor of Kinston's Normal Healthcare Hero. Public health nurse Donna Fiala is recognized as Carteret County's first ever Employee of the Month in August for her work and dedication in COVID, as well as many other things. UNC School of Nursing clinical instructor Michael Berry is answering the call to deploy in New York City in April. County public health nurses delivering a specimen to the lab in their PPE. If Robbie Goolsby, retired public health nurse, comes back to Henderson County to work as a contact tracer. Dr. Ellis Vaughn is sporting her public health pride while masking up. Edgecombe County PHNs showing just how essential PHNs are. Haywood County PHN Tammy Maney is staffing the COVID-19 call center, and Alamance PHNs don their PPE before going to collect a specimen in the very early days of the pandemic. And we all know that the story continues. There are so many pictures and stories that I did not receive. Public health nurses have been the absolute crux of every intervention aimed at controlling the spread of COVID-19. You serve communities in so many ways, from interpreting guidance for stakeholders, educating your communities, case managing and resource finding, case investigation, to the omnipresent contact tracing, answering questions, and individually caring for individuals who are sick or quarantined. Public health nurses are uniquely specialized to rise to the occasion. And I just wanted to say, take a moment to say that I see you. I see the countless hours of work you put in daily, weekly, and monthly in service to your communities. I see how tired you are, because I feel that too. But I want you to know that I see you, I hear you, and I feel your weariness. I am thankful for each and every one of you fighting for the health of North Carolina. You are making a difference. I want you to know that you are worth it. You are invaluable. You are worth it all. North Carolina public health nurses are North Carolina's very best nurses. And this pandemic has demonstrated in indescribable ways just how true that is. In 2020, 2021, I hope to be able to continue to advocate for the advancement and credibility of public health nurses across North Carolina. Public health nurses need to be at every table where decisions are being made about public health. There's nothing about us without us. And continuing to honor public health nurses, the nursing section has 2 scholarship recipients and 2 award recipients for 2020. Dr. Reed?
So I am honored to present the Joy F. Reed Scholarship to Dr. Jamie Lee Watts Isley. She is pursuing a master's in public health at the University of Missouri-Columbia, and currently holds a DNP from UNC Greensboro, or will hold one, did hold one, I guess, in May of 2020. So congratulations to Dr. Watts-Isley, and good luck with your further education.
Dr. Watts, are you here? Dr. Watts-Isley, are you able to join us today?
Yes, I'm here. Can you hear me?
Yes.
We can hear you now.
Oh, that's so weird. I don't know what happened. But I just wanted to say I'm very appreciative of this award so I can continue my studies in public health. And Dr. Reed, I wish I had gotten to meet you last year as well. But it's nice to see you this year.
Maybe one year we'll have face-to-face.
Yes, that would be lovely. Thank you, everyone. I really appreciate it.
Congratulations, Dr. Watts, on your scholarship. Your award should be in the mail to you if you have not already received it. Great. Next, we have our nursing section scholarship. The recipient this year was Mary Elaine Knight. Mary Elaine is a school health nurse working for Catawba County Public Health. She's a nationally certified school nurse and is currently the president-elect of the School Nurse Association of North Carolina. She's working towards her master's in nursing, community public health nursing, with a concurrent graduate certificate in nursing education from UNC Charlotte, with an expected graduation date of fall 2022. She has several goals for her nursing education that she shared. Mary Elaine could not join us today, but please join me in congratulating her for her achievement as we honor her as the recipient of the 2020 Nursing Section Scholarship. Congratulations, Mary Elaine. Great. Susan Little will be presenting the Margaret Dolan Award recipient.
Hey, everyone, give me a hands up, or those of you on governing council or the leadership, if you can hear me, because I just got booted off and
We can hear you.
We can hear you, Susan.
I think she lost her audio.
Yeah. Hang tight just a minute, Dr. Hardy. Susan, would you like me to present? And thank you everyone for hanging with us as we explore this world of technological advancement. Thank you for your patience.
oh, can you hear me now?
Yes, we can hear you. There's quite a bit of an echo.
Yeah, if everybody could mute, and if you're not presenting or not part of the leadership team, if you could turn off your camera I keep getting booted off. So if I stop in the middle, Lindsay, will you take over if I get booted off in the middle? Okay. Can you hear me fine? Let me get it okay? Okay, great. Thank you. The Margaret B. Dolan Award is a high achievement in North Carolina public health nursing. Through her contributions in the direct services and in many varied leadership positions, Margaret B. Dolan made significant impact in improving the health of the people of North Carolina and the nation. On October 19th, 1972, the Public Health Nursing Section of the North Carolina Public Health Association unanimously voted to establish a Margaret B. Dolan Award to honor Mrs. Dolan and recognize persons who made significant contributions in the field of public health. In 2018, the nursing section leadership voted to have the chief public health present this award each year. So this year, I'm honored on behalf of the North Carolina Public Health Association Nursing Section to recognize Dr. Kimberly Hardy as the 2020 recipient of the Margaret B. Dolan Award. Dr. Hardy is the Personal Health Division Director and Director of Nursing for Pitt County Public Health Department in Greenville, North Carolina. Dr. Hardy completed her BSN, MSN, and Doctor of Nursing practice studies at East Carolina University College of Nursing in 1991, 2001, and 2017, respectively. Dr. Hardy has worked in several capacities over the course of her career, including advanced practice registered nurse, nurse faculty, and nurse administrator. In March 2019, she was inducted into the ECU College of Nursing Hall of Fame and recognized for work as an exemplary nurse leader. Her clinical focus area includes women's preventative health. Dr. Hardy also has a special interest in improving the quality of healthcare services and has implemented several quality improvement projects to improve access to those services for underserved, high risk, and vulnerable populations. Dr. Hardy is adjunct faculty at the East Carolina University College of Nursing and serves as preceptor for graduate level nursing students. Dr. Hardy was a fellow in the Duke Johnson & Johnson Nurse Leadership Fellowship inaugural cohort in 2013 and 14. She attributes this program as a catalyst for her interest in nursing leadership and quality improvement. Dr. Hardy is a member of Sigma Theta Tau, North Carolina Nurses Association, American Academy of Nurse Practitioners, and the North Carolina Public Health Association. She serves as chair of the Eastern Region of the North Carolina Association of Public Health Nurse Administrators. Dr. Hardy is married and has 2 adult children and an adorable grandson. Her personal interests includes women's ministry, Christian education, and holistic health and wellness. Congratulations on your achievement, Dr. Hardy. Your plaque is in the mail, and a nameplate honoring you will be placed outside of my office, the Office of the Chief Public Health Nurse at the North Carolina Division of Public Health. Congratulations.
Dr. Hardy, are you with us this morning?
Yes, I am. Thank you very much. It is an honor to receive this award today. Thank you, Dr. Little. Thank you, Executive Committee.
Thank you, Dr. Hardy, and congratulations on your incredible achievement in public health nursing.
Thank you.
Carolyn Rose, are you with us this morning? I'll ask again in a minute. The Chair's Choice, or PHN Superhero Award, will be given annually at the Fall Educational Conference to honor a nursing section member who has demonstrated superhuman or super nurse powers, who is dedicated to protecting the public's health and fighting evil public health villains. By most definitions, public health nursing superheroes do not require active superhuman powers to fight threats to funding, accurate information, service provision, assessment, assurance, and policy, derive superhuman status from their sheer dedication to public health nursing practice and colleagues. Public health nursing superheroes use their powers to counter public health issues while also combating threats against humanity and health from known and unknown supervillains. While dictionary.com defines superhero as a figure, especially in a comic strip or cartoon, endowed with superhuman powers and usually portrayed as fighting evil or crime, we define superhero as a public health nurse that has superhuman strength of character, superhuman selflessness, superhuman humility, superhuman capacity for patients, superhuman commitment to public health, and superhuman dedication to the public health nursing profession. This year's public health nurse superhero embodies the super nurse powers of patience, strength of character, commitment to public health, and dedication to the public health nursing profession through their work and commitment to public health as a nurse leader in their agency and their professional association. Carolyn Rose, are you with us this morning? Is she here?
I don't think so.
She might not be with us. That's okay. We have this recorded for her. This year's recipient, Carolyn Rose, consistently demonstrates patience and strength of character through her sage wisdom when the stress of the response to the COVID-19 pandemic often causes us to lose our bearings and need a trusting other to lean on. Carolyn demonstrates her abiding leadership and constant counsel as a PHN leader, truly dedicated to ensuring her peers have the resources they need during COVID-19. Carolyn demonstrated dedication to public health nursing profession and superhuman commitment to public health when she created the logo that NCPHA nurses now recognize as our very own call to public health nursing at heart. She has demonstrated commitment to public health as a nurse leader at the North Carolina Department of Health and Human Services through her commitment to the health and well-being of all North Carolinians, and also her years of service and leadership in the North Carolina Public Health Association. Congratulations, Carolyn. We have a surprise that's been created for you, and we hope that you enjoy. And now I would like to present our 2020-2021 NCPHA Nursing Section Executive Committee. Would our 2020-2021 officers make sure to turn on your cameras, please? We welcome some new leadership this year and maintain many current committee members who are excited for the opportunity to continue to serve. I'd like to present the Vice Chair of Communication, Cody Brayboy, for the North Carolina Department of Health and Human Services. Secretary, Joy Smith, Gaston County Public Health. Treasurer, Carolyn Hemrick, North Carolina Department of Health and Human Services. And Vice Chair of Education, Dr. Marianne Cockcroft from UNC Chapel Hill. Our immediate past chair will remain Dr. Susan Little, from the North Carolina Department of Health and Human Services. I will stay on as chair for Forsyth County Department of Public Health. And our chair-elect will be Dr. Jamie Lee Watts-Hesley from UNC Chapel Hill. Please join me in recognizing the 2020-2021 Nursing Section Executive Committee members. And thank you all for agreeing to continue to serve, or for starting to serve in this capacity, the nurses of North Carolina Public Health. I'm very excited to work with you all next year. So this is wrapping up our annual business meeting, unless there are any questions. I just wanted to let you know, if you're interested in learning more about the NCPHA nursing section, including any interest in serving on our dynamic executive team in the future, please navigate to the NCPHA nursing page to view our materials and willingness to serve forms, and I will drop the link in the chat box in just a second. We really need leaders like you to join us and maintain the momentum and the advocacy for public health nurses in this section. You can also follow us on Facebook and Twitter using the hashtag or handle NCPH Nursing, and I will drop those links as well. And for those who are registered for the Fall Educational Conference, please join us at 9:15 to listen to the Chief Public Health Nurse, Dr. Susan Little, deliver the annual State of Public Health Nursing, and I will drop that link in just a second as well. Are there any questions from anyone who is attending? You can drop them on the chat box or unmute yourself and say something.
The chat box is disabled on
Oh,
my
is
end.
it?
Mhm.
Okay, well, just if you have a question, please feel free to just shout out. All right. With nothing said, I will drop those links and you can peruse them, and please join us. If you are registered for the Fall Educational Conference, please join us at 9:15 for Dr. Susan Little's address. Thank you all for being with us today, and congratulations again to our scholarship and award recipients for 2020. We're so appreciative of your achievements in public health nursing.
Happy birthday, Felicia.
Thank you, Carolyn.
Happy birthday, Felicia.
Thanks, Lindsay.
Oh, boomerang, go, go away. Boomerang, go away. Boomerang, go away.
This is Jamie. I was going to say hi, but instead you got to hear my son sing a song about telling the dog to go away.
I really like that. I appreciate that. That's wonderful.
Oh, Lindsay, you did awesome. Sorry I couldn't put my camera on.
That's okay. I'm working on getting the links into the chat box for.
I'll see you guys soon.
All right. Bye, Jamie.
I'd like to say happy birthday to Felicia. This is Deborah Herring, one of her old school nurses from in the day. Happy birthday, Felicia. Good to see your face. You can't see mine. Retired people not going to
Thank
be
you, Deborah. Good to see you on.
all right.
I'm gonna be doing your rate February. Retirement rates.